if you are a patient and you experience a pain somewhere in the body or one symptom or the other somewhere in your body, one of the first confusion that will come to your mind is, what kind of tests can I go to the hospital or to the lab to tell them I want to run to figure out what is going on in my body? Relax, today I've come to give you such information, right? And if you are a consultant using the 𝗵𝗲𝗹𝗆 tracker device, the 𝗵𝗲 device, the NLS device, and you run a full body scan and you check and you are seeing hundreds of items in the list that have been generated, and you see quite a number of them that are reading red, and you are wondering which one should I give priority to when it comes to further investigation, relax, I've come to give you such answers. So today I'll be sharing with you top 10 organs that you should give priority attention to whenever you run a full body scan. And I will also be sharing with you the kinds of tests that you can run in the lab or in the hospital if you are a patient that wants to go to run a scan in the hospital. Okay, so out of the 10 of them, so that this video will not be too long, I will share details of about 6 of them. Okay, and the rest you can get from my online masterclass course in natural medicine. All right, in my online masterclass course in natural medicine, we have courses like medical lab science, where the several kinds of tests were listed and explained, so you know what kind of tests you would like to run. You subscribe for my online masterclass course in natural medicine. Some of the courses that you're going to see there are the likes of medical lab science, lab report interpretation. You will get all those details in my natural medicine online masterclass course. But if you want to understand how to interpret some of these results with the NLS device, with your 𝗵𝗲𝗃𝗏 device, with your 𝗵𝗲𝗹𝗆 tracker device, okay, because almost all the kind of tests that I'll be sharing with you here, you can actually find them in your NLS device, with your 𝗵𝗲𝗹𝗆 tracker, with your 𝗵𝗲𝗃𝗏 device. All right, so but you will need to subscribe for my online masterclass course in NLS device and 𝗵𝗲𝗃𝗏, or 𝗵𝗲𝗹𝗆 tracker online masterclass course if you have the 𝗵𝗲𝗹𝗆 tracker device, to understand how to carry out such investigation. Okay, as I speak to you, we have over 1,000 subscribers so far as of today in 37 countries. So what are you waiting for? I don't want to waste more time trying to talk about it, but go and subscribe for my NLS device online masterclass course. Go and subscribe for my 𝗵𝗲𝗹𝗆 tracker online masterclass course. Go and subscribe for my natural medicine online masterclass course, and you are going to get full details of all I'm about to share with you in this video. Top 10 organs that you should investigate whenever you finish on a full body scan. Number 1, the heart. Number 2, the brains. Number 3, the lungs. Number 4, the liver. Number 5, the kidney. Number 6, the pancreas. Number 7, the gastrointestinal organs and the colon. Number 8, the reproductive organs. Number 9, the thyroid gland. Number 10, the skin. These 10 that I have mentioned are the organs that you should give priority attention to whenever you run a full body scan. Okay? You are going to see a long list, but these ones are the ones that you give priority attention to for further investigation. Now, for those of us that want to run tests in the lab, in the hospital, let us start with the heart. Why is the heart the most important to carry out or to give priority attention to? It is because currently research has told us that heart disease is the leading cause of death globally. Heart disease is the leading cause of death globally. Okay, so if you want to run tests for heart disease, what kind of tests can you run? Okay, number 1, you can go for what we call ECG, electrocardiogram test. Okay, where it is checking for the levels of the heartbeat. All right, for you're trying to check for arrhythmia, you're trying to check for tachycardia, and so on. Number 2, you can go for echocardiogram. Echocardiogram, that's a sound test trying to check for heart enlargement, and the status of the heart, okay, and other stuff related to heart disease. All right. So ECG, echocardiogram, those ones are focusing on coronary artery disease to check for the health status and so on. Number 3, you can also go for stress test. All right, you go there, you tell them you want to run for a stress test. If the heart is being stressed, you need to run a stress test to know what is going on there. Number 4, you could go for lipid profile test. When it comes to lipid profile test, you are talking about investigating the HDL level, the LDL level, the triglyceride levels, and so on. Number 5, you can also go for blood pressure test. It's also a device that you can also have at home, or you have a sphygmanometer, right, trying to check for high blood pressure or low blood pressure, or if your blood pressure level is normal. One thing about the heart disease is that sometimes, take for example, blood pressure, you may not experience symptoms immediately, all right? So that's why it's very important to go for these tests, okay? But the good news I've come to share with you is that with your NLS device, you can actually get all this information there. And every other ones I'm going to share with you. So why don't you go for rather an NLS scan and get such information all in one package, all in one test. If you are going to go for different tests I'm talking about, those are different, maybe different facilities to carry out different tests and so on, and you will spend a lot of money. But with the NLS technology, you can carry out most of these tests. You can get almost all this information in one scan. In one scan that takes about 2 hours, right? So that's why it's important that you plug into the NLS device technology. Number 2, brain. Why should we run brain tests? Why should the brain be a priority organ? It is because every other body functions has its control by the brain. And one thing about the brain is that when there's a neurological disorder, it is sudden and it is disabling. Okay, take for example stroke. When stroke happens, it happens sudden and it changes everything. So you don't want to wait until things have escalated before you go for a brain test. All right. With the NLS device, you can also get all this information. With the lab, you can run tests like neurological exam, MRI scan, CT scan, trying to check for if it's a high risk or if there are symptoms that are already showing. Okay, and you could also run cognitive tests for the brain. Cognitive tests trying to ensure that the memory is still functioning and the cognitive function of the brain is functioning well. Okay. Number 4 is what we call carotid test. Carotid ultrasound test. All right. The carotid are the arteries. They are somewhere around here. They are the arteries that supplies blood and oxygen to the brain. All right. If it is compromised, there's going to be a shutdown, either total shutdown or partial shutdown, and that is part of what leads to certain types of stroke. Okay. So that's why the brain is a very important place to check if you are beginning to notice something that is out of place in your body. Number 3 is the lungs. Why should we give priority attention to the lungs? The lungs, the respiratory system, is a common site for chronic disease manifestation. Can you remember during COVID-19? One of the most common symptoms that was dropping millions of people dead was respiratory symptoms, pneumonia, and so on. All right, so we need to run tests to check the vital capacity of the lungs. All right, there's a connection between the heart and the lungs. If you're not exhaling and inhaling well, it is a marker, it's a pointer to a sub-health condition. So what kind of tests can we run? We can run chest x-ray, we can run CT scan, especially for people who smoke. All right, so it's important to run chest x-ray when it comes to lung disease, CT scan, or pulmonary function test, oxygen saturation test, or spirometric test. CT scan, chest x-ray scan, pulmonary function test, oxygen saturation test, or spirometric test. All right, spirometric test is the one that checks for the vital capacity, the tidal volume, the total lung capacity, ability to exhale and inhale, all right, without having issues. You're able to take in deep breath or exhale deep breath, all right, without having issues. Then you know that you are fine. Number 4 is the liver. Why should we run tests in the liver? It is because a lot of things that has to do with detoxification of our body, metabolism, and digestion. The liver plays an important role when it comes to that. When it comes to detoxification, when it comes to metabolism, when it comes to digestion, the liver plays an important role. And one funny thing is that the signs of a liver damage does not show on time until things have gotten worse. Right? That's why it's important to run certain kinds of tests, like the liver function test. When it comes to liver function test, some of the kind of tests you run there is what we call the likes of the ALT test. ALT means alanine transaminase. Alanine transaminase. Okay, this is the kind of test that checks the level of ALT enzyme in the blood. What's the function of ALT? It's an enzyme that converts protein to energy for the liver cells to use up, right? A situation whereby the ALT levels are high, then it is a pointer that there's an injury to the liver or there's a damage somewhere. The ALT levels are not supposed to be elevated except there's a problem, then that's a marker. Another liver function test is what we call the AST test. The AST test is called the aspartate transferase test. Aspartate transferase test. That is also another type of enzyme that speeds off chemical reactions in the body. So when there are elevated levels in the blood, it is pointing to a damage going on somewhere. Maybe kidney disease, it may be a liver disease, and so on. All right, it may be heart disease. All right. Then another one we run is what we call ALP test. That's the liver function test. ALP, right? That's alkaline phosphatase. Alkaline phosphatase. When there are elevated levels of alkaline phosphatase, it's implying that there is either a damage to the liver or a damage to the bone. All right, those are key places, key organs where you're going to find ALP enzymes there, right? So when you have elevated level of ALP, it's implying that there is a chronic disease going on somewhere in the bones, somewhere in the kidney, or somewhere in the liver. If the levels are low, it may be implying maybe a case of malnutrition, anemia, or the likes. You just need to have a normal level of ALP. Just need to have a normal to low level of AST, normal or low level of ALT, and you'll be fine. Another liver function test you run is what we call bilirubin. You're trying to check for levels of bilirubin in the body. Right? If they are elevated, it's showing that the liver is not functioning well. There's a damage to the liver. Right? So those are liver function tests. And the amazing thing is that you can actually get all this information too in your NLS device, but you need to understand where to check when you subscribe for my online masterclass course in the NLS device. Okay? Another type of scan you can run with the liver is what we call the ultrasound or fibroscan. You are trying to check for fibrosis. Alright? Those are scans that you can check if there are fibrous tissues that are growing in the liver. Another type of scan for the liver is what we call the hepatitis screening. Hepatitis screening. In your NLS device too, you can check for hepatitis A, hepatitis B, hepatitis C, hepatitis E, hepatitis G. They are all there. Okay? You will need to learn how to interpret such results. Alright. Number 5, kidney. The kidney regulates fluids and electrolytes in the body. Okay, the kidney filters of waste from our body. Alright, so if the kidney is not functioning well, there will be a problem. You may have fluid retention, pains in the left side or the right side, and so on. Right, so what kind of tests can you run in the lab to find out what is going on. You could run tests like creatinine test, you could run tests like urinalysis, you could run tests like BUN, blood urea nitrogen test, you could run tests like ultrasound. You're trying to check for inflammations, you're trying to check for infections, you're trying to check whether there's a damage to the kidney. The sixth one, which I'm going to stop so that this video will not be too long, is the pancreas. The pancreas. Why should we run a pancreas? Why should we investigate the pancreas? Okay, it's because insulin is involved. Insulin is involved. Digestion is involved. Inside the pancreas, you're going to find the likes of the islets of the Langerhans. They are responsible for the production of insulin, which helps to metabolize the food that we eat. All right, trying to take away glucose from the bloodstream into our body cells. All right, so if the pancreas is not doing its work, you want to check whether there's a damage somewhere. So what kind of tests can we run? We can run the likes of blood glucose test. Blood glucose test. You're trying to test for diabetes. You can run 𝗷𝗵𝗹𝗆 test. You're trying to check whether there are high levels of glucose in the blood. If there are high levels of glucose in the blood, it means they are not. It's either there's an insulin resistant condition or there's a little or no production of insulin that should help to absorb glucose from the blood into our body cells. It's implying that there's a problem. Okay, on that kind of test, you could also run when it comes to the pancreas is what we call the amylase and the lipase test. Amylase and the lipase test, those are different enzymes that are used to break down fats and so on. All right, so if these enzymes are not actively working, it's going to reflect when you run an amylase and lipase test. Okay, another type of test you run when it comes to the pancreas is imaging. Imaging, okay, you are trying to check whether there is a damage or check the level of damage to the pancreas. Okay, so just not to make this video too long, I'm going to stop here, and I also want to reiterate, if you want to get details of this and much more, go and subscribe for my online masterclass course in natural medicine. You're going to get information on how to prepare herbs, how to treat chronic disease with herbs, and much more. You're also going to get information about human anatomy, basis of human anatomy, basis of biochemistry, and medical lab science. It's in that particular course inside natural medicine where different kinds of tests were explained, what this test is meant for, all right, and so on. Then lab report interpretation and many more. It's a total package that will make you a complete consultant for your practice. So what are you waiting for? Go subscribe for my online masterclass in natural medicine and you're going to be complete.